Arise 6 minutes past 12 from Radio 91.7, Nigeria's first and only radio station for women and their families. Glad to know that you're still there tuned into this though. And yes, if you are just joining us, we're super glad to have you on that other side, tuned into Women Radio, WFM 91.7. Today is Thursday, day 4 in the month of July 2024. I really do hope that your morning has been a great one for you. Thank you very much for joining me on The Big Question today on Women Radio, WFM 91.7. The Big Question is a program where we discuss and prefer solutions to issues affecting us as a nation and, of course, as citizens. The Big Question is broadcast on weekdays 12:05, and, of course, do well to join the conversation by calling us on 07000 917 917. Send us a text and a WhatsApp message on 0703 175 6537. Log into our website www.wfm917.com. Download your mobile app, the WFM 917. Send your thoughts to our social media platforms, the WFM 917. That is how you can be a part of the conversation for today. Yesterday on The Big Question, we will be discussing the topic, women's reproductive health and rights. My name is Blessing Agbeto, and yes, our conversation for today will be based on critical issues surrounding safe abortion, the suspension of the Lagos State guidelines on safe termination of pregnancies, the Violence Against Persons Prohibition Act, and the provisions for the health and safety of women, and all of that. So joining us today, we have Dr. Toyin Ajao, a restorative healing researcher and practitioner at Moon Goddess Consults and Imole of Africa Center, iAfrica. She found iAfrica to spread solidarity and advance restorative healing and Ubuntu culture across Africa. Her research interests include intergenerational healing, healing justice, conflict transformation, systems change leadership, visionary and intersectional feminism, and gender and sexual rights, amongst many others. She is a board member of progressive organizations such as Vision Spring Initiatives, Women's Technology Empowerment Center, and Bridging Gaps South Africa. Good to have you on the show for today. I am super glad to have you join us today. Good afternoon, and how are you doing today, Dr. Toyin Ajao?
Awesome greetings, their blessing. I'm doing well today. How are you yourself?
I am well and blessed. Thank you very much for joining the conversation for today. All right.
Thank you.
Yes, Dr. Toyin Ajao has joined us on the conversation today. And yes, throughout our discussion, we will explore the impacts of limited access to comprehensive SRHR, that is sexual and reproductive health, and of course, safe termination of pregnancy in individual families and the community. And of course, we will also be inviting opinions and probable stories from our listener. Just in case you're seeking clarity, this is where you should be. So we seek your support in advancing these critical issues. Your voice matters, your opinion counts, and together we can work towards a society that respects and opposes the reproductive rights and health of all women. So yes, it is time for us to delve into the conversation fully for today. Remember, you can call us on 07000 917 917. Send us a text and WhatsApp message on 0703 175 6537. Log into our website at www.wfm917.com. Download the mobile app, the WFM 917. Send your thoughts to our social media platforms, the WFM 917. That is how you can be a part of the conversation for today. All right, Dr. Ajao, I would like us to start the conversation for today. Let's do it this way. As a restorative healer and a human rights activist that you are, in your professional opinion, do you think there is a relationship between lack of access to sexual and reproductive health services and mental health and well-being?
Of course, my answer to that is a mega yes. There is an interconnectedness, and interconnected relationship rather between the lack of access to sexual and reproductive health services and mental health and emotional well-being. First, because you can't separate your hormones from who you are. Your hormones and your well-being, your hormones are your well-being conduits. That we have to really get straight. And second, because the inability to access accurate information, non-judgmental and inclusive health services, family planning, contraception, as well as preventive or swift treatment of sexual abuse, sexually transmitted infections, STI, or even the ability to have safe abortion and gynecological services are enough adverse effects on anyone's mental health and emotional well-being when these services are not available. And the adverse effect those we have on the psychological, mental, and emotional lane of a person is the feeling of isolation, stigmatization, shame and guilt, anxiety and depression, and other psychosomatic traumas that can result from this lack of access. So, of course, there is an intricate link between the lack and mental and emotional well-being.
All right, thank you very much. I mean, you've mentioned a whole lot just now, and I would like to also know, how does societal stigma surrounding denial and restriction to comprehensive sexual and reproductive health services contribute to feelings of shame and guilt, particularly among young persons who are unable to access comprehensive services? Yeah, I have two in one question, but let me ask that one first. So that we can have clarity about what we're talking about today. Over to you, Dr. Jao.
Yeah, thank you. I think in your question, did you ask for the psychological consequences?
No, I did not ask about that. I would ask about that later.
Oh, okay. Sorry. I wanted to.
So I'm asking, what are the ways by which societal stigma surrounding denial and restriction to comprehensive sexual and reproductive health services contribute? How does it contribute? The societal stigma, how does it contribute to the feelings of shame and guilt, particularly among young persons who are unable to access comprehensive services?
Yeah, it contributes in a lot of ways because, first and foremost, this is a very tough issue because it's intergenerational. And the way it contributes is when you have a society that is puritanic and moralize and police sexuality in the way we have in Nigeria. It's very easy for a person to start even hating themselves before they know who they are in the world. And imagine now with that, demonizing who you are for being a sexual being because your culture, your upbringing, and your religion is saying otherwise. It's telling you that even being sexual is problematic. And everything we learn about sexuality in that way is misinformation. It's not letting young people know that exploring their sexuality is amazing and there is a freedom and there is right to that. So when all of this thinking and thought and, conditioning have been ingrained in us, and you will see even the custodian of this policing, they've summed themselves up in this situation as well, thinking that's the best way to enter the world and express themselves. So what is being handed down to them, they hand it down to other people. I recall when I was young, my mother would say things like, I will translate that. Just go out there and let somebody, sleep with you, then you bring pregnancy. And, when you're hearing that, all you're thinking is, okay, nobody's touching me. Pregnancy, no, I'm running away from it. It still does not save you from feeling all the hormones that your body will feel because you're a sexual being. And at the end of the day, you may have to now start seeking information from people who don't even know anything themselves about how to go about your sexuality and, expression of who you are. So in that sense, it's a lot, to unpack.
All right, thank you very much for that one. Even though we have to be mindful of what we say on radio, particularly at this time. Okay, thank you very much, Dr. Ajao, for your explanation on the show for today. Okay, so now let's talk about the psychological consequences of this stigma. I mean, all of these things that you have mentioned, what are the psychological consequences?
Yeah, part of the psychological consequences of policing sexuality and shaming and moralizing how young people should express their sexuality with lack of adequate information is going through fear, having a lot of fear, anxiety, panic, and sadness. And what that means is by the time they're boxed up in this space, they begin to have heightened ways of wanting to explore nonetheless, and this might lead to risky behavior. And sometimes the use of drugs and other substances to cope with what they are going through. And then many would go ahead to now develop unhealthy relationship with sex. Yeah. And when they are in trouble, what they would now end up doing is patronizing quacks or seeking advice from ignorant people. And then that is a vicious circle of calamity. And in no way is that helping their psychological development and how they relate to their sexuality. And again, more devastating is the fact that without now having any safe space and any safe services, any non-judgmental services, that may lead them to making more unwise choices and decisions in relation to their reproductive health and sexual life as a result of being scared and afraid and not wanting to be judged by anybody. So these are just too many psychological consequences to bear for somebody who is a sexual being whom society has not even invalidated before they even understand their body and their sexual needs.
All right, thank you very much for your thoughts on the show today. 07000 917 917. That is the number to call to be a part of the conversation. Send us a text and WhatsApp message on 0703 175 6537. Log on to our website, www.thebfm917.com. Download the mobile app, the BFM 917. Send your thoughts to our social media platforms, the BFM 917. That is how you can be a part of the conversation for today. Remember, this is the big question on Women Radio, WFM 91.7, Nigeria's first and only radio station for women and their families. And today on the show, we are discussing women's reproductive health and rights, and our conversation is tilted towards the critical issues surrounding all of the issues of stigmatization and the psychological effect, particularly when it comes to women's reproductive health and rights. My name is Blessing Agbeto, and our guest for today is Dr. Toyin Ajao, a restorative healing researcher and practitioner at Moon Goddess Consult and Imole of Africa Center, Africa. All right, Dr. Ajao, let me come back to you now to ask you this one. Now, from your experience, do you think we have support systems for young people to access psychological support? Because, I mean, we've talked about psychological consequences. So from your own experience, do you think we have support systems for young people to actually have access to psychological support?
Thank you so much. What I would say is we have support system, but the question is this support system enough? Is it holistic? Is it addressing the issue? Because we still need to remember that because our society has so much pathologized the protanic behavior, our policies, laws, and practices are, in that sense, not yet holistic in attending to SRHR realities and needs of young people. So, and then the psychological support that is available maybe in hospitals mirror that kind of approach in itself, where the issue is you go there, you want succor, you want somebody to understand what you are going through, you want to talk about, unplanned pregnancy and all other things, and then you are judged. Or the person that's supposed to provide that psychological support is already going like, OMG, oh, that is a sin. Why do like all sorts of things? And to be honest, most of the support system that is kind of providing a bit of non-judgmental and safe support in that sense emanating from the civil society and community-based organizations. And while this is helpful, is still a bit unfortunate because the government should be compelled to really take this as a national issue so that the healthcare system and society can do their job as well of recognizing that sexuality is part of who we are. It's like when I said the things I was told as a young person in Yoruba, you said, let us be mindful because this is the radio station. It's the same system of policing what we say, of not speaking out, how we should, and calling sex what it is, letting people know the right information that they have. We help them. And then that there's nothing to be shameful about expressing your sexuality. So in that sense, for me, sexual rights are basic rights. And they are not supposed to be this kind of rock science that our society has made it be. And just to round up on that, I just think that while support system may not be essentially available in that sense, the one that is supportive of young people is at least helping them have awareness, understand, what protection means and how they can equip themselves with some form of information to help their psychological well-being and emotional, health. And how this lack of support, the one that I'm saying is not enough, is having issues is causing problem is that stigmatization that they are still confronting, and that discrimination has to be part of what society actually dealt with for everybody to be at peace with their sexuality. So I think I will leave it at that.
All right. Thank you very, very much for your thoughts on the show this morning. 07000 917 917. Now let's talk about you for a moment. Now, in your work as a human rights activist, how do you promote the empowerment and resilience among individuals, particularly those who have been affected by lack of access to comprehensive and non-discriminative reproductive health services? And I'm also interested in the strategies that you think have proven effective in fostering psychological well-being.
Okay, thank you for that question, Blessing. So as a feminist activist and a restorative healer, I do invite people into spaces of holistic healing so that they can first understand the need for self-care, the importance of collective well-being, and the utmost need to prioritize their mental and emotional well-being. These are very critical, and that is a right for them to have adequate information about SRHR. Then, part of what that work has involved in terms of building resilience and empowerment is to let them understand the social and political contradictions around SRHR and how that impacts their lives. Because you see, they've been guilt and shamed, but they need to understand that contradictions. You will see many people who are even guilting them in that way might have been making the same mistakes that they're trying to make sure these young people are not making, but not teaching them the right way. Yeah. So it becomes a vicious circle of intergenerational trauma, like I said before. So part of what that work is, this healing work and the in-depth understanding that they are beginning to get is giving them the kind of exposure that they need to get the kind of support that they need, and to know that they themselves can become part of that support system by utilizing the information that they have to assist others. So sometimes where urgent help is needed for the young individual, they are referred to organizations that can offer them real-time support. The progressive civil society organizations and CBOs that are in existence. So these strategies are kind of helping young people in assessing psychological well-being. And particularly the other thing that I'm so happy for is that the young people themselves are engaging through social media to break these long-haired erected barriers to their well-being through courageous conversations that they are having. So that, again, is another form of breaking through this conundrum.
Mm. All right, thank you very, very much for your thoughts on the show this morning. Now, what role can a restorative healer and other mental health professionals play, particularly in advocating for policies, prioritizing reproductive health, and how can the intersection of mental health and reproductive justice be further addressed in advocacy efforts?
Thank you so much. I think 3 things are coming to mind on that front.
Okay.
First is that both mental health professionals and SRHR service providers must re-educate themselves about the importance of being safe spaces for young people to come to. They are not supposed to be the space of judgment and scrutinizing them on what they should do or not do, but safe space where the information that they need will be available to them, where sex is not demonized and where they are not stigmatized and judged. And the professionals themselves have to improve their mindset to be able to really accept realities about sexuality instead of shying away from that and thereby re-traumatizing their patient. They must be on board with the empirical evidence before them and stop participating in puritanism and discrimination. So that's one. The 2 more points I have quickly is, secondly, they must work together at the intersection of mental health and emotional well-being of their patient and for their patient. And they must partner with organizations that are at the forefront of SRHR education and policy advocacy to support their effort. And the last but very important as well is that they must remember that they have the power to influence the government towards providing comprehensive SRHR policies and laws that will be implemented in a way that society begins to move from this stigmatizing and judgmental behavior to holistic practice that can make, young people appreciate who they are and know that nothing is wrong with being sexual beings.
All right, thank you very much for your thoughts on the show for today. It has been an enlightening one. So just before I let you go, what would you like to say to everyone listening right about now as your parting words?
Thank you so much. I'll just say thank you for joining us, and I hope this conversation is helping you now to stimulate your own mind and get on board with SRHR education and support young people psychologically and mentally and emotionally, and let them appreciate their body and who you are. And that for the young people out there, for you to know that the system is failing us. You are not the failure, and there's nothing shameful about you being a sexual being. However, make it your responsibility to learn safe way, to learn the holistic way to express who you are, and seek those people who have trained themselves to be there for you in the way that is supportive and affirming.
All right, thank you very, very much, Dr. Toyin Ajao, for being a part of the conversation, for sharing your invaluable insight and experiences on the show for today. Do well to enjoy the rest of your day.
Thank you so much, Blessing. It's nice being in this conversation with you.
Thank you.
Thank you so
Thank
much.
you.
Yeah.
Well, there you have it from Dr. Toyin Ajao. Thank you very much for joining us today on that enlightening discussion on women's reproductive health and rights. I hope that you've been able to take one or two things away from the conversation for today. Let's do this again. So as we conclude, it is clear that the fight for comprehensive reproductive health rights and safe termination services is far from over. So we must continue to address the stigma, provide adequate information, and mobilize community support to ensure that all women have access to the health services they truly need. So yes to you for being there. Let's continue to stand together. Let's continue to advocate for change. Let's continue to work towards a future where every woman's reproductive health and rights are respected and protected. So yes, where I get to call it a wrap on the show for today. Thank you so and very much for being a part of the conversation. So yes, I will look forward to bringing you more impactful discussions in our next program. Many thanks to the executive producer, Tom Okewale Shunaya. The Big Question is a program where we discuss and provide solutions to issues affecting us as a nation and, of course, as citizens. So remember that conversations like this do not end here. We must continue to raise awareness on issues, continue to speak about the problems, and of course, most importantly, prefer solutions to it. Now, remember to continue to be a patriotic Nigerian. That one is very, very important. Till I come over again, my name is Blessing Agbeita. Good afternoon.